Hello everyone. In today's session, we'll be learning about the radial nerve. In previous two sessions, we had covered about the ulnar nerve and the median nerve. Okay, so all these three nerves are the major nerves in the upper limb from which long questions can be asked. So you need to prepare them well. So for that, we have made these notes. Okay, make sure you access these notes from the link in the description box. Okay, so let's begin with the radial nerve. Radial nerve arises from which part of the brachial plexus? Yes, radial nerve arises from the posterior cord of the brachial plexus. Okay, the three cords, right? Lateral cord, medial cord, and posterior cord. Radial nerve is arising from posterior cord. And look at the root value. It is C5 to T1. That means it includes the root value components of the entire brachial plexus. Now let's understand the course and relations of the radial nerve. So radial nerve arises in the axilla. Initially, it lies behind the axillary artery or posterior to the axillary artery, and then it enters a space called as lower triangular space. Okay, these are intermuscular spaces surrounding the shoulder. Okay, and in the lower triangular space, it is accompanied by this vessel, the profunda brachii artery and the veins. Okay, and behind the humerus, there is a groove called as a spiral groove. It crosses the spiral groove. Okay, and then at the middle of the arm level, it pierces the lateral intermuscular septum and enters the anterior compartment of the arm. Okay, now try to remember the ulnar nerve. Ulnar nerve was piercing the medial intermuscular septum and was going posteriorly. Okay, and radial nerve, it is coming anteriorly. Okay, radial nerve basically supplies posterior compartment muscles. In its course, it is just coming anterior here. Okay, and since it has came anterior, we know that it is one of the content of cubital fossa. Okay, in the cubital fossa, the lateral most content is radial nerve. Okay, at the level of lateral epicondyle, it terminates into the superficial branch and deep branch. The deep branch of radial nerve is referred to as posterior interosseous nerve. Okay, this nerve enters the posterior compartment of the forearm by passing between two heads of supinator muscle. Okay, so if you read about the major nerves, the ulnar nerve is entering the forearm by passing between the flexor carpi ulnaris muscle. The median nerve, it is passing between the two heads of pronator teres muscle. Okay, the radial nerve is passing between the two heads of supinator. Okay, specifically the deep branch of radial nerve. Okay, the superficial branch of radial nerve is the lateral most content of cubital fossa, as we all know. It descends along with the radial artery, and then later on it goes posteriorly over the roof of anatomical snuff box. Okay, this area here is referred to as anatomical snuff box. It is present in the roof of anatomical snuff box, and then it enters the hand to supply this area. Okay, the dorsum of lateral 3.5, excluding the areas which are supplied by the median nerve. Okay, these areas are supplied by median nerve, so that's why they are not shaded. Okay, these purple colored areas all are supplied by radial nerve. Okay, now let's learn about the branches of the radial nerve. We'll see the branches region wise. So in the axilla, we can see this branch, the posterior cutaneous nerve of the arm, and branches are given to this muscle, the triceps muscle, long head as well as medial head. These two, it's written in the region of arm, but if you carefully note, these branches are given up in the axilla. Okay, so in the axilla, there is a branch to the long head as well as to the medial head of the triceps. Okay, then in the arm, we can see again branches to the triceps, branch to the lateral head as well as the medial head. Okay, medial head received a branch in the axilla as well, and it is getting a branch again in the arm. Okay, then it gives a branch to the brachialis. When it comes in the anterior compartment of the arm, here it gives this branch. Then brachioradialis, extensor carpi radialis longus, and also one more muscle, anconius. Okay, so all these muscles are supplied here. Then branch is given to the elbow joint. Okay, then most of the branches are given in the forearm region. Let's see that. In the forearm, there is a branch of the radial nerve called as the deep branch, also referred to as the posterior interosseous nerve. Okay, and there is the superficial branch which lies superficially and supplies the skin over the lateral side of dorsum as well as the lateral 3.5 fingers. Okay, except the region which is supplied by median nerve. Okay. Then deep branch of the radial nerve supplies these muscles: extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris. Okay. So these are the superficial muscles. Some superficial muscles were supplied here. The brachioradialis, the extensor carpi radialis longus, as well as anconius. Okay. One, two, three, and four muscles here. Okay. All these are supplied by the radial nerve. But note this: these three muscles are supplied directly by the radial nerve, and remaining muscles are supplied by the posterior interosseous nerve. Okay. Then deep muscles, this supinator, then these three muscles of anatomical snub box. Okay, in this region we had seen anatomical snub box. The boundaries of this anatomical snub box is formed by these muscles. Okay. The abductor pollicis longus, extensor pollicis longus, and extensor pollicis brevis, and this extensor indicis. Okay, the supinator, three muscles of anatomical snub box, and extensor indicis. Okay, so these five deep muscles are supplied by the deep branch, the posterior interosseous. Okay, so all of the posterior compartment muscles are supplied by the radial nerve. Okay, some are supplied directly by the radial nerve, and most of them are supplied by the deep branch of radial nerve. Okay, so this was about the branches, and now let's learn related applied anatomy. So whenever there is injury to the radial nerve, it leads to motor and sensory loss along the area of distribution of the nerve. Okay, then there's a condition called as crutch palsy. Okay, when patients uses crutch, then there is a chance of injury of radial nerve in the axilla. Okay, so this is the proximal most injury of the radial nerve which is possible, in which the entire radial nerve would be affected. Okay, branches of axilla, branches of arm, branches of forearm, all would be affected. Okay, so there is wrist drop as well as loss of extension at the elbow. Okay, why wrist drop? Because extension of the wrist is done by the muscles of the extensor compartment of the forearm, that is affected. Why extension of the elbow is lost? Because the triceps muscle entirely is affected. Okay, branches in the given in the axilla as well as arm, all are affected. Okay, then there could be Saturday night palsy, in which the radial nerve is compressed in the spiral groove. Spiral groove is present in the arm. Okay, so if there is injury here, the branches given in the axilla, they are preserved. Okay, the long head, the medial head, which received branch in the axilla, they are preserved. So that's why extension of elbow would be possible here. Okay, but the wrist drop would be there because the extensor compartment of forearm muscles are affected. Okay, so first of all, let's understand what is wrist drop. Wrist drop is a condition in which the person is not able to extend the wrist. Okay, the wrist is flexed. And when does it happen? When there is injury at the level of spiral groove or above it. Okay, why is it so? If there is injury below the spiral groove, usually this muscle is spared. Okay, when there is injury below the spiral groove or inferior to the spiral groove, extensor carpi radialis longus, it is a strong muscle for extension at the wrist. Okay, so that is why we say the injury should be at the spiral groove or above it. Okay, because if injury is below, this muscle would be spared and it will not lead to wrist drop. Okay, so that concept is explained in this condition. Okay, for now, first understand wrist drop. What is happening here? Loss of extension of wrist and fingers, loss of supination in an extended elbow. Supination in extended elbow is done by supinator muscle, okay, which is supplied by radial nerve. And supination in flexed elbow is done by biceps brachii muscle. Okay, so that's why extended elbow is specified here. There is sensory loss in the dorsum of the hand as per the area of distribution of the radial nerve. Okay, and there is this condition called as radial tunnel syndrome. Okay, radial tunnel syndrome, in which there is injury at the elbow and it is compression of the deep branch of the radial nerve. Okay, only the deep branch of the radial nerve is affected. The deep branch of the radial nerve supplies all these muscles, but note this muscle is spared, extensor carpi radialis longus. Okay, this muscle is not affected, so that's why Weakness of wrist extension is there, but there is no wrist drop. Okay, as this muscle is paired. Okay, so this concept is very important because many a times if you read this word radial tunnel syndrome, so students may feel that radial nerve is affected, so there would be wrist drop, but it doesn't happen in this condition. Okay, because of the normal function of the extensor carpi radialis longus. Okay, so this was about the radial nerve. Let's quickly recap which all headings we covered in this session. Yes, we started with the origin of the radial nerve. It arises from the posterior part of the brachial plexus. The root value is entire component of the brachial plexus. Then we saw the force in the relations in the axilla, in the arm, in the middle of the arm. It is coming in the anterior compartment by piercing the lateral intermuscular septum. Okay. And at the level of lateral epicondyle, it terminates into its superficial branch and deep branch. The deep branch is referred to as posterior interosseous nerve, which passes between the two heads of supinator muscle. Okay. Then superficial branch is the lateralmost content of cubital fossa. Then later on it goes and supplies the skin in this region. Okay. Branches of radial nerve we saw the posterior cutaneous nerve of arm, and these two branches are given in the axilla branch to the long head as well as medial head. Then branches in the arm, again lateral head and medial head. Okay, medial head receives branch in axilla as well as in arm. Okay, then some muscles of the forearm, they are supplied in the region of arm itself, the brachioradialis, extensor carpi radialis longus, and coneus. Okay, and remaining all posterior compartment muscles are supplied by this deep branch of the radial nerve, the posterior interosseous nerve. Okay, then in applied anatomy, we learned about crutch palsy, Saturday night palsy, and wrist drop is a very important topic that you need to learn. Okay, many a times short note specifically on wrist drop is asked, where you are supposed to explain about this concept. Okay, and in this radial tunnel syndrome, wrist drop doesn't happen because the extensor carpi radialis muscle is paired. Okay, so make sure you access this PDF from the link in the description box, and please do watch other sessions of this YouTube channel. Thank you.